The thyroid is your best friend in your entire body, and it's your gas pedal, and it drives your metabolism. People have heard of hypothyroidism. That's super common. It's just basically your thyroid is not functioning very well, okay? And so people that have a hypothyroidism or low functioning thyroid, they're tired, they're dragging, they can sleep for 16 hours a day and they don't feel like they've slept enough. A lot of people have weight gain and because their metabolism is so low. Then there's the other extreme. You can have people with hyperthyroid, where you can have too active of thyroid. And for those people who have problems with, they sleep for 4 hours a night, and they're like, man, that's good. 4 hours a night, 2 hours a night sleep, I'm good. And weight loss for them, and it sounds great, it sounds amazing. Who wouldn't want to be hyperthyroid? But one of the problems with it is you can get heart arrhythmias. Your heart starts beating funny, and it can kill you. So no one really likes that. And there's also something called a thyroid storm. It's whenever your thyroid is way too high, or you're taking too much thyroid medication. All that's not surgical, but your thyroid is really your gas pedal for your metabolism. The thyroid issues, there's reasons to take out a thyroid, and those come in basically two big flavors. There's non-cancerous and cancerous reasons to take out a thyroid. Typical cancerous lesions that you get in the thyroid, the most common are papillary and follicular. Those are the two most common. And typically, if you get those taken out, you're going to do pretty good. Those are the most common types of thyroid cancer, and they're also almost good actors. If you catch them early enough and they're just contained to the thyroid, sometimes you can get by with just taking part of the thyroid out. It's called a lobectomy. Sometimes you take the whole thyroid out. Usually that's a pretty good disease, and like the 30-year survival for a small papillary is about 95%. So people do pretty good with that one. There's a couple other cancers that you can get with the thyroid, medullary and anaplastic, and those are a little more complicated to deal with, but it's still something that if you have a thyroid mass, you need to be checked out for. Non-cancerous reasons to take out a thyroid would be something like a goiter. Every once in a while you see someone with this big old neck mass hanging around, and it can cause problems with breathing, it can cause problems with swallowing, and cosmetically it's a large structure. So those, usually what you do is you do a biopsy on those, just like you do with a cancerous lesion. You're like, okay, well, it's not cancerous. There's some medical things you can do to try to decrease the size of it. And you talk to people about that. Hey, what can we do medically to decrease the size of the thyroid? And then what are your surgical options? And sometimes it's a combination of both. Like, well, you take some medication, it gets a little bit smaller. Well, it's still large. And then you take out the thyroid in order to help with the breathing and swallowing and things like this.